Before today's episode, I have a special announcement that I'm so excited to share with you. If you are currently expecting twins, triplets, or more, or you know anyone else who is, then you are going to love this. Most often than not, getting the news that you're carrying more than one baby can come as a complete and utter shock. Add to that the increased health risks and monitoring, and it's no surprise that many expectant mothers feel overwhelmed, exhausted, and stressed even before the babies arrive. And the truth is that most expectant parents do not fully prepare for the challenges that come with raising more than one tiny human at a time. So I'm putting together a 3-part workshop on how to beat overwhelm and prepare for raising multiples. It's completely free, and if you can't attend live, you will have access to the recordings. You can get all the details at my website, fiercekindmama.com. And if you know anyone else who might benefit from this training, please feel free to share the details with them. I can't wait to see you there. Welcome to the Fierce Kind Mama of Multiples podcast. This podcast is for anyone raising multiples, twins, triplets, or more. I speak to inspiring parents of multiples who have healed from unexpected pregnancies and birthing experiences, and who candidly share the highs and lows of raising multiples. I also speak to the professionals that work with multiple birth families. Together, we cover the practicalities of raising more than one baby at a time, as well as enhancing the emotional well-being of caregivers and children alike. Come join us as we laugh, cry, and share our personal and professional wisdom on all things multiples. I'm your host, Dr. Christina Kebetza, and I am a fierce, kind mama of multiples. On today's episode, I'm joined by Dr. Erin Bowe. Erin is a clinical and perinatal psychologist, course creator, and business mentor. She's the author of 2 books, More Than a Healthy Baby, Finding Strength and Growth After Birth Trauma, and Social Media Detox for Mums, A New Way to Find Balance. Erin hosts the weekly Mum As You Are podcast, and she also teaches students from 45 countries in her mental health courses. In this episode, she speaks about her own birth trauma, how to recognize the signs of birth trauma, and what parents of multiples can do if they have experienced a difficult or challenging birth and have symptoms of trauma too. I hope you enjoy this episode with Erin. So I'd love to welcome on today's episode, Dr. Erin Bowe. Erin, lovely to connect with you.
You too. Thank you.
Why don't we start by you telling us a bit about yourself and the work that you do?
Sure. So I wear many hats. I am a mum of 2 daughters. They are 5 and 7. That's my main role. I'm also a clinical perinatal psychologist. I've been doing that for about 14 years now. I am an author. I am also a podcaster. I run about 7 different mental health courses. I do a lot of things.
Oh, wow. Yes. And I'd love to hear more about all of those things. Can we start a bit about your professional experience as a perinatal psychologist?
Yeah, so I always loved perinatal work even before I had my own children. Mostly what I specialize in now is birth trauma, which is something never in a million years I ever would have chosen. Trauma does not choose most things. I had 2 traumatic births myself. So with both of my daughters, despite doing hypnobirthing, having a doula, doing all the preparation, being a psychologist, all of that didn't make any difference. I still had 2 traumatic births myself. And so from that, I feel there's been some real post-traumatic growth that's come from it, because I came out of that relatively okay. And I thought, well, if I did that, how did I do that? And how can I possibly teach other people to do that? So that's been a bit of a passion project of mine.
Yes, right. And I think that, a lot of times I do speak to people who have a passion for something, and it's often that it doesn't come by accident. It often comes from personal experience. Could you tell us a little bit about your personal experience with birth trauma?
Yeah, so I suppose I'll give you the short versions, because I'm also mindful of details, and sometimes that can be tricky for people. So the Reader's Digest version, as we'll say, my first daughter, I went to 40 weeks. I had gestational diabetes. Maybe yes, maybe no. That's a whole other story. So I agreed to be induced. Birth itself was amazing, very calm, very empowering. But given the speed at which she came out superwoman style with like one arm up, and she had ripped as she went. Didn't feel anything at the time. I had kind of the stereotypical physiological birth, no medication other than the Syntocinon, anything like that. But afterwards, I started to feel some pain in my back, and that was lots of hemorrhaging and injuries. So that got to a stage where it was like 10 out of 10, like pain and just distress. So I went in for surgery, and that sort of started like a cascading of, I just felt like I'd been run over by a truck, basically. Breastfeeding was hell. Like recovery was pretty hellish as well. And it was just like, I don't even know what happened. I think that when I've spoken to lots of women and families over the years, it's been that real sense of like just too much, too fast, too soon. I don't even know what that was. So that was my first birth. The second time around, I opted for some more choices, not being a first time around again. My second daughter turned out to be an absolutely massive baby. So I didn't have gestational diabetes the second time, interestingly. She was 5 kilos on the dot.
Wow.
I was told, although I'm 5'4", so that was a bit of a surprise. And I was told all the way through she was probably measuring big. And I said, no, la, just, my body will do what it wants to do. That was what I chose. And then the second time around, I agreed to have my waters broken. That seemed to get things started. Turned out she was probably trying to descend and was getting stuck. So she had shoulder dystocia, which is where your shoulders get stuck. And that was the most intense 3 minutes of my life. So I was doing really, really, really well. And then all of a sudden, some procedures needed to happen. Still, I suppose, again, what you'd call a physiological birth. I don't tend to refer to it as natural birth because we're in a phase culturally, climately, where natural is sort of sometimes put up on a pedestal. And I'm mindful also of your audience who've had multiples who are not, it's just tricky, right? So I call it physiological birth, okay? So no C-section, but it was tricky. And that was like, again, what was that? What actually was that?
Yeah, absolutely. So I can almost just imagine the physical pain you would have been through and that trauma, I guess, physically, from that point of view.
It was intense. So I personally, a strategy I used mostly from hypnobirthing was to not call it pain, was to call it sensation. And so when I focused on it being sensation, I think that's partly how I got through it. It's different for everyone, but that's what I partially used, I think, to get through it, to be like, this is a strong sensation that will be over soon.
Yeah, I love that.
Eventually.
I love that as a strategy, actually. Absolutely, not referring to it as pain. Could you speak to us a little bit about what birth trauma is? Because I know that for a lot of the audience that would be listening to this, mums of multiples, many women that I've spoken to, or even, just heard along the way, casual conversations, they'll speak about not even realizing that they had a traumatic birth. Mm-hmm. Because, as you pointed out earlier, many women do, not all, of course, but many mothers of multiples give birth via cesarean section. It might even be planned. It might, in that regard, they might have been expecting that. But often what happens can be something unexpected, like premature birth, time in NICU or special care nursery, all of that kind of stuff. And so later on, when they bring their babies home and they then realize sometime later even that actually they might have suffered a psychological trauma that what kind of went undetected, unnoticed. So I wonder if we could speak a little bit about what is birth trauma and differentiating, is there a difference between physiological birth trauma and psychological birth trauma and what those differences might be?
Yeah, there's so much to unpack there. And I will say birth trauma is not known, really. It's the 1 in 3. Like we know it's 1 in 3, but that's not what women are putting into Google. Right. So often by the time I see someone, there's been a lot of searching, a lot of conversations, many, many, many other people involved before someone even comes to me and says, oh, this is what I've had. You're someone who can help me with that. So there really is no difference. Like the details are not that important, not to someone like me anyway. A birth is traumatic if someone says to me it was traumatic. Full stop. End of story. The details, you're always going to find someone who you somehow objectively think has had it worse than you and that you shouldn't complain, that those details are not interesting to me. I'm more interested in, like, how did you feel about it? How was that interpersonal experience? Because a lot of the trauma is actually around interpersonal experience. It's how you were spoken to. It's how you were treated. It's how your partner was treated. Language that was used, things that were not helpful, or coercion. Like, there's so much that goes into it. So if we think about, like, I guess, a horizontal line, and at one end is maybe what you'd call birth regret. So there are people who kind of go, it didn't really go to plan. It maybe wasn't exactly what I wanted, but there's not necessarily symptoms that go with it beyond the kind of like reflective regret. So we'd maybe call that birth regret. If you move up the line a bit, there's maybe what's called little t trauma, as in there's some symptoms. There's flashbacks, there's some anxiety, there's just generally not feeling very good about it, tearfulness, can range a lot for different people. That's kind of like, psychologists would call that subclinical PTSD. We'd maybe call it acute distress disorder, sort of resolves after a bit of time. Then you've got the big kahuna, the big T trauma, which is post-traumatic stress disorder. Unrelenting symptoms, pretty much will not go away on its own. There's no amount of being grateful. There is no amount of insight. There is no amount of affirmations and inspirational floral quotes on Instagram that is going to help with that. You need specific, helpful, targeted guidance for that. That's my kind of take on PTSD, I suppose.
Yeah, okay. So there's that continuum from regret to clinical disorder, what we would call post-traumatic stress disorder. So what does the interventions look like for the different, along that continuum? How would you work with someone, say, experiencing birth regret versus subclinical PTSD, or little t versus big T PTSD, post-traumatic stress disorder?
Yeah. So, it's tricky because the scale that most people get after, or when they're pregnant and also after they've had a baby, is it targets anxiety and depression. So the Edinburgh scale, most people would have had it at some stage, whether they remember it or not. Everybody's supposed to be screened. It's an amazing tool, but it doesn't screen for trauma. So I would say over the last decade or so, the amount of women I've seen who have been referred for perinatal depression or anxiety, and trauma hasn't even been something that was considered. It's getting better now, but often I think that can be a starting point with people. If you've maybe had a diagnosis for depression and anxiety and it's just not shifting, also flashbacks about birth, feeling anxiety about birth and breastfeeding and the NICU experience and all of that is not typical of depression, and it's not typical of anxiety when it's really specific to that particular situation. So that's sort of the first place, I guess, to start. Interventions are broad. In Australia, we're mostly using cognitive behaviour therapy. Compassion therapy is really helpful as well, I've found, but that's not necessarily like a first of line thing that everybody knows about. I'm big on strength finding, of using like the kind of positive psychology, post-traumatic growth, to kind of see, what did you do to get through that? You got through it. What can we do to bolster those strengths? And then, of course, there's eye movement desensitization and reprocessing, which is becoming more and more used as well. And it's really, really helpful for people when there's gaps, I think, in their memory. And they've often, when they come to me, they've already told their story like 5, 6, 7 times. Sometimes not. Sometimes I'm the first person to receive it, but often I'm not. Clinical psychs typically don't work in birth suites. As you know, we don't see people on the floor just after they've given birth. We see them after they've talked to X, Y, Z number of people. So sometimes it means trying a few different things before you find the right approach.
Yeah. And one of the things that I was thinking when you were speaking was, who are those different people that they might be talking to before they get to you? How does someone find their way to you normally?
It just depends. So it depends on whether the experience with the birthing team was positive and helpful or not. I think for some people it can be really helpful to go back to their midwife and debrief. When you've had something more like birth regret or little t trauma, that can be helpful. And part of my birth trauma training for birth workers is skilling up those people. So doulas, nurses, midwives, OBs, photographers, yoga instructors. There are a lot of people involved in the perinatal space. And so often it would just be, who is someone I feel comfortable talking to? And if that's been helpful and useful, then sometimes I come down the line later on when it's like, okay, there's more to this than sitting and doing a birth debrief. That's a really popular intervention, but it's important for people to understand a birth debrief is not a standalone tool. It's not effective as a standalone tool if you have more complicated, not even necessarily complicated, but if you have symptoms that need relief, then we need to target those symptoms, and revisiting the story sometimes can make it worse rather than making it better. So we've got to kind of be careful in how we do things. But yeah, absolutely. For most people, and most people will not go on to develop post-traumatic stress disorder. Most people will fit in that sort of lower end of the continuum. And so child maternal health nurse, going back to talk to your OB, someone like that you feel safe with, very, very different if you feel there's been obstetric violence, if you've been coerced, if there's been racism, prejudice, that kind of stuff, then you don't want to be going back to talk to those people necessarily, because sometimes a birth debrief is confused with something that's a little bit more like, okay, you're going to sue us, right? It's not actually about your mental well-being and your child's well-being. It's actually like legal management.
Yes, yeah, absolutely. And you also mentioned something about a questionnaire that people get that it's kind of like a screening for anxiety and depression following the birth. I didn't quite catch the name of that, and I'm not sure if listeners would have heard it. Could you repeat that for us and tell us a bit more about that?
Yeah, so sometimes it's called the EDP-OS, I think. I just call it the Edinburgh. It's the Edinburgh postnatal something's going on. I've forgotten it off the top of my head. But as a routine, most women are screened for it by their midwife before and after the birth.
Yeah. Okay, great. Yeah. And then you briefly touched on some of the symptoms, or that people coming to you will have symptoms. Could we spend a little bit of time talking about that? What are the signs and symptoms of trauma, just generally, that apply to what we're speaking about here in the sense of birth trauma?
I think for most people, it's that sense that it's still happening. So even though your logical brain knows that the moment has passed, it still feels like it's happening. And that can be whether you hear your baby crying, whether it's time to do a feed. That's a really big trigger, particularly if there's been breastfeeding trauma. But every time that there's things happening, you feel like you're back there and the anxiety is just coming up. Your brain doesn't know the difference between something that happened yesterday and something that's happening right now. So it feels very much in the moment. For some families, it's things like not being able to drive past the hospital, hearing alarms going off if you've been in a hospital for a significant period of time. Just those little noises of alarms going off can send physiological alarms going off. I've had women who can't stand a certain colour because it was painted on the walls in the birth suite, it was on the uniforms of the midwives. So reminders from all of your senses. Visual, smell is a really powerful one, connected to trauma as well. Certain smells like cleaning products or anything, hospital smells in general. It can be things like nightmares, flashbacks, just having those like unrelenting preoccupation with it. And the more you try to stop thinking about it, the more, it's like feeding the seagulls chips. As we say, the more that you think about those thoughts and tell yourself not to think about them, the more you get. So it's an inability to just shut off from it at all. For some people, it's not necessarily part of post-traumatic stress criteria in itself, but it's very much related. It can have issues with bonding and attachment. So a lot of people, maybe not initially, definitely not necessarily in that first session, but we'll talk about they just don't feel that connection, which we know is a biologically wired thing, particularly if you've had a medicalised kind of birth where your baby's been whisked away and you haven't had a chance to hold them, smell them, actually come into your body and feel what you're supposed to feel, which is all the oxytocin and love. You've just been feeling like distress. That can be tricky later on. And it's really important that we normalise that as well, to say that that happens to a lot of people, that you just handed this baby, it may as well be an elephant. What is this? I have no connection to this child whatsoever. And the guilt and the shame that goes with that is also really, really, really common. So yeah, nightmares, anxiety, flashbacks, feeling like it's happening right now. For some people, it can be anger. It's because underneath anger is a lot of fear and a lot of threat. I think a lot of women I talk to as well have this, it's almost like, I call it the shower fantasy. You stand in the shower and you think of all the things that you should have said, all the things you should have done differently, all the things you should have. Dads have that, partners have that a lot as well. It's I should have done something. Well, you can't. That's the bystander effect of birth, right? It's important to think about this for partners as well, because under any other circumstances where your partner is spoken to rudely, held down, had things done against her will, your partner would step in and do something, right? If a woman was knocked down in the street, people would be there to say, what is going on? What are you doing? But in birth, it's like, stand back, accept it. Doctors are the experts, don't get in the way. So, yeah, there's so many multi-layered things that go with trauma.
Yes, yes, absolutely. And when you were speaking, I was wondering about that. Do you see a lot of dads in your practice?
No. The short answer is no. Often if they do come, it's because it's been at the strong insistence of their partner, but it's still culturally, it's the same with having postnatal depression in dads. It's still not something that is like accepted, that this is a thing. I'm here to tell you vicarious trauma is absolutely a thing. And I think people can relate to that sense of vicarious trauma if you think about like something happening to your child. I would rather take a bullet than watch my child be shot. That's a very, very extreme example, but I use it because it tends to stay in people's minds. So watching your loved one go through pain and being treated horribly is, I'm not saying it's harder to watch, but I'm saying there's a whole other layer of trauma there as well, knowing that you stood back and didn't do anything, even though logic says you weren't allowed to do anything. But that instinct, that drive to protect, yeah, it gets shut off. And that can be very confusing for partners to navigate.
Yeah, absolutely. And, when you were speaking, I was thinking about the literature on vicarious trauma, and it is a real thing, absolutely. And it doesn't just apply when we love someone and we see our loved ones being hurt. It can even apply in our professional work, working with people and hearing stories of trauma over and over again.
Yeah.
We can also be affected by that as well. Some of the things that I was thinking about when you were speaking, it reminded me of, I've heard, women talk about women who've given birth to their multiples and unexpected things happened, talk about things like feeling disconnected from their body during the whole birthing process. And then afterwards, almost seeing this is particularly when the babies have spent time in NICU or even in the special care nursery, and seeing their babies as patients, like actually looking at their babies and not feeling that, initially anyway, not feeling that the babies are theirs, but that the babies are actually just these little patients in a hospital. I wonder if you could speak about that. And I guess, what's the mechanism? What's happening there for these women?
I think if you look at, again, like the physiology of birth and remembering that we are mammals, there are certain, I suppose, endorphin triggers that are, under the ideal circumstances, supposed to fire up, like oxytocin. So we know Sarah Buckley, she's an amazing GP who's done so much good research in this area, but just smelling a baby, like even if you have a cesarean birth with all the things, like even if you smell a baby and you can't feel anything, it will light up the oxytocin, and that helps with attachment and bonding. So there's things that we're not taught, I suppose, but I think I wish people could learn to smell a baby. It's a simple kind of thing, but if you think about mammals being wired and attachment, if those hormones aren't happening, and I guarantee you they're not if you're in trauma, because trauma will completely shut all of that down. You go into survival mode. It shuts down all the kind of like loving, bonding, attaching hormones. And it's very, very normal. If you, as I said before, if your babies have been whisked away and you've barely even had a chance to look at them, let alone touch them and try and connect, your brain naturally just doesn't really know the difference. So it's a process that takes time. And I think for a lot of people, it's a protective thing as well. Sometimes it's actually more partners I will often hear about talking about this is like, I don't want to attach. I'm afraid. And so when you're living in constant fear of, alarms going off and things being wrong, it sometimes is that it's the thing alone at night that your shadow doesn't actually want to acknowledge, but it's like, I don't actually want to bond with this baby or these babies because I'm afraid of what it's going to cost me if I lose them.
Yeah. It's really powerful when you put it that way. I can really sense how someone would be apprehensive, about even just holding their babies if that was taking place psychologically and I guess physiologically as well, as you spoke about, the hormones not having that time to connect. Attach in the traditional way, if you like, or the ideal way, I should say, being able to hold your baby and smell your baby and allowing for that oxytocin to kick in and do its thing.
Yeah.
What are some of the strategies that you recommend to parents if they're struggling with things like this in terms of attachment and bonding that results from birth trauma?
It's starting slow. It's starting slow and making sure that you yourself and your own body is okay with touch, because it's a big ask sometimes when your body has felt like a vessel that has had things done to it rather than a source of love and nourishment and joy and all that sort of stuff. So for some people, it's starting really, really, really slow by being okay with touch and being touched and just spending, it's like we're talking like not rocket science, but also nothing like miraculous, but also practicing gazing at your child and just gazing into their eyes. Doing it for short periods of time because babies can only take so much social stimulation at once anyway. Singing, we know that singing's great for the vagus nerve and settling anxiety. So just all those things, allowing yourself to bring in those things that you imagine that you would do, holding your baby's hand, smelling them, looking into their eyes. I think it's a hurdle sometimes for people to get through. And what you were talking about before with the hesitancy. I mean, my husband's an identical twin. There's a story like in his family about how his brother was the second one born and they didn't think he was going to make it, so they didn't name him for, I want to say like a week. I'm sorry if that's not true for any of his family who listen, but they didn't think he was going to make it, so they didn't name him. He was baby B for about a week, I think. You would never know now, but it's one of those, it's often stayed with me because I think if they'd been born maybe even a couple of years earlier, so they were born early 80s. If they'd been born in the 70s, they probably wouldn't have made it. They were 10 weeks premature, very, very tiny. So you think about it, we joke. So my daughter Lily, who's 5 kilos, she weighs more than both of them. But I think she makes up the equivalent of like 2.5 of them. So it's, you can't predict these things, right? It's just, I think that's part of it too, is trying to find the lightness in things, not making light of the trauma, but I know for me personally, like trying to find the light through this and find some humor, it helps relieve some of the tension.
Yes. So when you were talking, I was thinking about this visual imagery of the light at the end of the tunnel. And, often our mind wants to stop at the darkest part. That's where we get caught up in. But when we're going through something difficult and challenging, it's better to kind of keep going until we get to the light at the end of the tunnel. And it made me think about this idea that you mentioned that I'm not sure if listeners might know what it means, the idea of post-traumatic growth. And I wonder if you could explain a little bit about what you mean by that, and particularly in the context of birth trauma.
Yeah, so the word that people usually are familiar with is resilience, which means you get through something hard and you kind of go back to where you were before. So it's kind of like the status quo, equilibrium, and things kind of restored and you feel okay. Post-traumatic growth is interesting though. Like it's one of my favorite things to talk about because you have this level of growth that you just didn't think was possible. And so it's about the meaning that you make behind the event. You wouldn't have chosen it. I wouldn't have chosen to have 2 traumatic births. I don't think I would have chosen to have a 5-kilo baby. But, I suppose the very small piece that comes out of that is like I had no idea I could cope with that level. Like physically, mentally, everything. It has stretched me. Nothing has stretched me like that. I can't imagine going through anything like that ever again. But I guess if I did, I know that there's an inner reserve there somewhere. So it's about taking through, I guess, reflection and thinking, okay, how did I get through this? What am I going to make it mean? I think for a lot of us, and definitely in those early days, have what's called the extended pity party, like where you go through all of the things of like, I should have done this, it means I'm broken, it means all of that. I think that's a normal part of trauma. And I think it can be helpful to go into some of that ruminating and go through all of that. But then at some point you kind of got to go, right, and where's the full stop? What else am I going to make it mean? So it's finding the strength. Like, what did you discover about yourself that you didn't know you could do? For a lot of people, it inspires them to go on and do amazing things with their life, particularly if it's spreading the light. It's like, okay, I found this little light. Like, that's how I kind of think of it for me. It's like, well, I found this little pocket of light for myself. How do I be the lighthouse then? And then spread that to other people, which I would not have done in a million years. I probably would have still helped people with birth trauma as part of perinatal, but I wouldn't have had the impact of like, oh, right, I've actually been through this myself. How did I get through that? Because it certainly wasn't with just time will heal wounds and things get better. There's like particular things that had to get me to that point of going, what am I going to make out of this?
Yeah, it sounds like there were a lot of lessons you learned about yourself in your own
Yeah.
experience. Yeah. And that's helped you now help others with some similar experience.
I think something in it had to come out of me. So I kind of channeled that into work, I suppose, which was useful in the sense that, like, I wrote a book. I did that when my daughter was still tiny. I look back and I'm like, I don't know how I did that. Like, I had a baby in a carrier jiggling at the kitchen bench and I wrote a book because it had to come out of me. I developed a course, then I developed another course. So one for birth workers and then one for parents. There's all sorts of resources out there that I've created on birth trauma, and I'm one of many. I'm not special, but it's like there's something in me that had to come out, and it's come out, and it seems to have helped some people. So that's something good that's come out of it. You know, my daughters get to see their name in a book. And I'm like, well, it's because of you that I wrote this book. Thanks very much.
I love that because, your children, often people talk about their children being their source of inspiration. And, I know for myself, my own matrescence journey certainly led me to, I want to create this podcast as an example, right? So I just love that you turned what some people would say is a negative experience into something actually really quite remarkable and really wonderful for the community of mothers who may not know where to go to when, something like this happens to them.
Yeah. And that's often how it goes. You become an expert in the thing.
Yeah.
You talk to any parent whose child has had an illness, an injury, a disability, they become the expert. And I have one of those children too. He's got like a really, really rare genetic disorder. It's a new mutation. Doesn't really impact her life too much, but it's like you become an expert, right? You know more about it than every other medical person that you're likely to see to become a specialist. So sometimes it's the small things there. It's like I never would have known about this in my life before, and now like I'm the go-to person.
Yes, yeah. I'd love for us maybe to end the conversation with just some practical tips or some advice that you would give to multiple birth families, that parents themselves who may have gone through a difficult or challenging birth experience and are wondering if they have trauma, or, they recognize maybe that they're struggling. What can they do?
It is tricky. It is tricky. So I think the first thing that's usually helpful is just to allow everything, all the thoughts, all the feelings. The more that you try to squash them down and push them away, the more of them you're going to get. It's that ironic process theory that we talk to about clients sometimes. It's like if you try not to think about the pink elephant and you tell yourself not to think about it, you are going to think about it. So allowing some space, some time to just have all the thoughts, all the conversations, all the ideas without saying, oh, but I shouldn't think that. A big one I hear a lot of is like there's a thought and there's oh, but I should be so grateful because I've got a healthy baby, which is why I call my book More Than a Healthy Baby, because it's like that is not the gold standard. It's nice to have a healthy baby, but we also need healthy parents. So allowing all of that in without feeling the need to say, oh, yeah, but, right? Or compare. That's another thing. Oh, but I didn't have it as bad as someone down the street, or like just allow your experience to be your experience, right? So starting with that. The next bit is trying to integrate it, trying to find the pockets of information that fit with other pockets. Often with trauma where there's been dissociation, there's often big blanks. But if you can give your brain a story with a beginning, a middle, and an end, even without all the details completely filled out, things will settle a little bit. The brain tends to overreact. And I say overreact not as in it's an overreaction, but I mean there's extra activity. I want to be careful with my language there, but giving it a story to sort of put into things into a context. And then from there, eventually, not like I can't even put a timestamp on it, but like finding some meaning. What are you going to make it mean about yourself? You can choose to see that you're broken and that you did things all wrong, or you can choose to go, well, I'm strength, I'm here, I did the best that I could. Like often that's a useful kind of just affirmation there in itself. I did the best that I could. Yeah, I did the best that I could with the tools and the information and the circumstances that I had. So from there, there's all sorts of tools, strategies, people to talk to. I mean, like how long is a piece of string? But I think even just as a starting point there, the having compassion for yourself is really important, and finding the strength, even if it's just one thing that you can go, okay, I did that, okay-ish, and then we build from there.
Yeah, I absolutely agree. I think it's really important to build in some kind of positive I guess, what I was calling a memory network,
Yeah.
building in like, what did I do that was positive out of all of this? Or what am I doing even now? Yeah, coming out of the other side of it, that's
Mm.
positive. And that can be helpful to reframe, can't it?
Yeah, and even if positive is a tricky get to, sometimes even neutral. Like sometimes I've talked to people who are so shattered by this experience that the best they can get to is you did the best that you could because you love your child. And if that means you're stuck with, oh, but I shouldn't have done this, and they whisk them away and this happened and that happened, it's like you made the decision that you made based on love for your child, and that's doing the best that you can. So yeah, even finding the neutral things.
Yeah, I totally agree with that. Another thing that you were saying that I think is so important too is not comparing yourself to others. I know even for myself, I did that a lot too when I had premature babies, and I would say, oh, but how lucky am I because they both survived?
Mm.
And I think a lot of multiple birth parents do that. They almost feel guilt about feeling bad about their birthing experience
Mm.
because their baby survived, like that's the benchmark, that at least they survived. That's all I could have hoped for. Yeah. Which is such when you think about it, it's such kind of a sad way of, I guess, measuring your birthing
Well,
experience.
also health in general, right? So that like I always say to people, like, I think I've said this on every single podcast, but like that's the basement. It's not the ceiling. Like a healthy living baby is not the ceiling, that's the basement. That's the basement we should be aiming for. There is so much more to health. Like so much more to health, maternal health. Like, oh, we could go on and on and on.
Yes, we could, couldn't we? So, Erin, I'd love for you to just let us know where people can find out more about you. We're definitely going to put all the links to your books and the podcast in the show notes. But if people were wanting, to find out more about your services or how they can get in touch with a perinatal psychologist, where would they go?
For me, it's really simple. I don't use social media anymore. It's one place. It's my website, drerin.com.au. Super simple.
Love it. Great. Great. Thank you so much. Well, thank you so much for your time today. It was a pleasure chatting with you.
Oh, same. Thank you.
Thank you. Thanks for listening to today's episode. If you like what you've heard, then please follow and leave a review so that other expectant and current parents of multiples like yourself can find this podcast and the valuable information it contains. I'd be so very grateful if you left a review and shared this with anyone you think could benefit from listening. If you have a particular topic you'd like me to cover on this podcast, feel free to reach out to me via my website, fiercekindmama.com. New episodes are released every second Wednesday, so I'll see you back here real soon. Any advice and information in this podcast is general only and has been prepared without taking into account your particular circumstances and needs. For tailored, individualized advice, please consult with a qualified professional.